Good evening and welcome to my Insta Live session this Saturday evening. Today's guest is a very special guest. She's a dear friend of mine and she's also the pioneer of beauty industry, the medical beauty industry, that is cosmetology in India. And she's a dear friend, a very gracious soul, and she is one of the stalwarts of our Indian beauty industry. So if there's something that she doesn't know about Indian skin, it probably is not worth knowing. And I'd like you to welcome my dear friend, Dr. Jamuna Pai from Mumbai. Hi, Jamuna.
Hi, Chai. Thank you for inviting me on your live Instagram show.
Thank you for accepting. Oh my God. If I have to have somebody from India, it has to be you. We cannot start without you.
You're too sweet. Thank you.
Like like I was telling everybody that you were the first person to start medical beauty or cosmetic medicine in India way back. Do you want to tell us how it all happened?
Oh, God. That's a story. I think every time I started that way. Anyway, you can see, even at my age now, I'm a grandmother, but look at the way my face up for your show. So it
You
was
are
always
amazing.
this passion of mine that despite being a doctor, I wanted to do something in beauty, and so I went, learned beauty, came back, did whatever I knew of medicine, put it together to cut it all short. Made my mistakes because there was no one before me who I could just go and say that this is the protocol. And so I made my own protocols. The Western protocol didn't suit Indian skins. And so the story went on and made my mistakes, lost my clients. But then we had Indian protocols. And then there were these smart young doctors like you who took it forward.
Well, it's because we have
I,
inspirational people like you.
sorry, I was very well prepared, but
I know sometimes these angles keep changing. It's hard. Yes, that's a lot better. So you're right now in Mumbai because that's home to you, even though you have a chain of clinics by Skin Labs by Dr. Jamuna Pai across India. And how is it in Mumbai right now? How is it not? How is it being home, or are you back at work? How is it?
so, Chytra, we started work, I mean, seriously, only in the last 3 weeks. We tried going at that first relaxation that they offered, but again, they
Mm-hmm.
said it is non essential. There was a debate, and then we thought, why, when the numbers were increasing, why simply go and expose ourselves? But now we were going the first 2 weeks, 3 days of the week, and now we've made it 5 days, but all of us don't go because we have reduced the staff from 22 to 5.
Mm, I can
Hardly.
imagine.
And from all those number of clients that we used to see per day, we are just having about between 5 and 8 clients per day. That's it. The number of hours also we have reduced. We made it from
Right.
8 to 5 instead of 9 a.m. to 8 p.m. So all those changes, and of course we are in, like all of us are in the our PPE kits. So it does get a little stifling at times, but then for that many hours, but it's okay. I mean,
I bet.
Chaita, the whole world is going through. Whenever we want to begin to grumble, then we say the whole world is going through this. So,
That is true. I bet you never ever thought that there would come a day where you would be practicing in a PPE suit and you'll have to cut back on your patients, right?
correct. We never thought. And the thought that today, how many patients are there? On the contrary, it was the other way around. We'd say, oh my God, so many, in a way. And it's like a jinx. And today we are saying, oh, how many patients today? Fine, I'll come, or I won't. A situation. I'm sure
That
it's
is so
temporary.
true.
Yes.
I think so too. But tell us now, everybody talks about treating skin, etc., right? We are specialists in Indian skin. So,
Yes.
do you think that people, when they take care of Indian skin, should look upon Indian skin differently, or can we just treat it like any other skin type?
So, when you're talking on an international scale, of course, you travel a lot more than I do, but we do meet at conferences, etc. But when we are talking at a typical Indian skin, we know that we are lucky. We are a type 4 by the Fitzpatrick whatever classification. That means ours is the kind of skin, because of the amount of melanin or the pigment that affords us the color. We are brown
Yes.
in, so we, of course, many people don't like it in India, but that is what is protecting us. We fall in that category where we tan very easily, but never burn, because as soon as the sunlight falls, our aging is all because of the sun. And as soon as sunlight falls on the skin, the melanin from underneath comes up, our brown pigment. That's why we tan. But it also prevents the rays, the sun's rays, the
Mm-hmm.
ultraviolet rays from going into the deeper layers and causing those lines and folds which we see in our, Caucasian counterparts when we go.
Yes.
They all may be much younger than I am, and but they have so many folds and wrinkles. So that is the protection. That so, but because of the melanin, which is saving us from aging,
Yeah.
we have a lot of problems associated with melanin. Either they are, hormone related, adolescence, pregnancy, postmenopause, or just because they are prone to it, genetically prone to it, certain medications, etc. But we do tend to have patchiness of the skin. There's no point you and I, expert, assessment we do of the face, give them lovely sculpted faces and good harmony and beauty, and at the end of it, if the texture or there is patchiness on the skin, then that, is not a whole beauty. So then I
Uh,
think getting the texture right and getting the patchiness, because I always tell, I do the Miss India girls, I mean the winners for the
yes.
international pageants. I always tell them when they talk about the color of their skin, I always tell them, let us work, make it into a seamless, brown, nice color, because that is one of the things most accepted in the world. They love it, our color. But if it is patchy, if it has scars, if it has pits or anything like that that comes in the way, then of course we have to work on it. But that is what we need to do: get a nice texture, smooth, nice skin, and no patchiness. So we
You're
have a
so
challenge
true.
with melasma or the patchy skin, because of the
That is so
pigmentation.
true. Yeah,
Yeah.
you're so right. Because, like, look, just looking at you, your skin is flawless. It's just beautiful, even tone. It's like a nice sheet, like it has to be. Compared to, like, let's say, young any skin. If even if they had a beautiful nose or fantastic lips, but if they had those open pores or patchy pigmentation or those scars, it distracts from the look. The evenness of the skin is so important.
Very important. So let us, talk about how are we going to protect ourselves from
Yes.
either, prevent this from happening, or what is already there, between you and I. Let's see how
Mm-hmm.
we can share notes and see how we
Yes.
can tackle it best. So I think first of all, educating our population on the use of a sunscreen is extremely important, even at home. So now that we've been home for 3 months, so often people ask me on these kind of
Mm.
workshops whether even now is it necessary, more so because of the gadgets that we are using and the blue light. It causes as much harm, if not more, because here the eyes also are harmed by the blue light. So then, how are we going about it? Sunscreen. You want to say something? How you do it,
Yeah,
Chaitra?
so basically, it's true. It's a good thing you brought it up because I had a patient of mine who's living in the States today who sent me a picture saying that I've got these red blotches on my skin. I've not been stepping out. Why is it? I said, have you been using a sunscreen? She said, no, I've been home. I didn't use a sunscreen. And then
Yeah.
she said, but I've been using a lot of computer and I've been doing a lot of cooking. So I said, both is heat, which means radiation, which means that you're getting heat, and that heat is a stimulus for pigmentation. So you must wear sunscreen even if you're at home. I particularly prefer telling patients use a SPF 50 at all times just because nobody uses enough sunscreen. But do you have a preference? Are you a SPF 20, 25, or a 50? What is your go-to?
So I tell clients normally if it is available to them between 30 and 50 is good enough. We live in a tropical country, so most of us experience the sun. At I think in Mumbai we have maximums. I mean we have sun all the 12 months. So using a thick coat of sunscreen, even the thickness of the coat is very important, but of course, we can't go to the extent where it really protects us because that becomes impractical. Really, a nice thick coat on our face, it would even spoil the dimensions of our face, right, Chaitra? So, maybe a moisturizer, and I'll try avoid going out between 10 and 4 when the rays are extremely sharp. If you can help it, use physical blocks. I tell my clients to use light colored because light colored clothes always deflect the light, dark absorbs. So I tell them to use cotton, light colored, big dupattas, kind of, and then
Mm-hmm.
just put it forward so that the sides of the face, unless they're driving, of course, the sides of the face are covered. And when they get off at whichever destination, just put it in their bags. So that is another form of physical protection. Then large glasses, sunscreen, and whatever else remain out of the sun as much as possible. Use nutritional supplements that will help.
Yes.
Yeah. So when you have the pigmentation from within, what we can do is nutritional supplements like vitamin A, C, both being antioxidants. L-glutathione, another antioxidant, whilst it's working against the free
Yes.
radicals, it also works on the pigment. It is the antioxidant now, very popular in India. And the others can be, without hydration, the skin always looks dark. So you can
Yes.
hydrate from outside with a hyaluronic acid based um, that
Gel.
goes for all skin types. You can use that as a moisturizer and from within, because immediately the darkness of the skin becomes less, and from within you can take sodium hyaluronate tablets, a tranexamic, which you spoke about first. I remember you saying you use tranexamic acid. That also helps the pigmentation. So all these nutritional supplements and all the care that you can take as much as possible when you're home. And of course, night repair cream, keep it simple, but let it have all these first very natural extracts like berry extracts
Mm.
containing arbutin, kojic acid, licorice, etc. Vitamin C again, it helps. And so you can use it as serum form or as in a repair cream or in a medicated form. You get those tubes. So whichever way, layer it on, but end it with a moisturizer. Even for acne prone skin, you can use these serums, gels, anything that will hydrate and not dry out when you're using these repair agents. It dries the skin. And if you're treating pigmentation, it always appears. Dry skin makes the pigmentation appear darker. Did I
You're
speak
right. Not at all, not enough. You could always keep giving so many gems and advices, Jamuna. You can never say too much. But like to summarize, so you spoke about sunscreen and layering of sunscreen, which we agree that the more the physical barrier, the better. And also oral supplements, like you spoke about L-glutathione, which is very popular in India with vitamin C, vitamin A. But I also use like alpha lipoic acid and lycopene, and in the past, we used to use polypodium, but now it's a drug, so it's a prescription medicine. And so these are the combinations of glutathione. And one of our viewers asked us, is there any adverse events or side effects to these supplements? But these are antioxidants. They are in your body already. So all you're doing is nourishing it by supplementing it. And if it's extra, your body will throw it out. So there's no adverse events as long as you have a good formulation that you're using. But Jamuna, one of the questions is, what is your favorite sunscreen? Do you have a favorite sunscreen?
so we make one, so that's our favorite.
I know, isn't
But
it? Yours is your Skin Lab, right? Your Skin Lab sunscreen?
yes, and that is actually, Chaitra, to be very honest, I'm never biased, even though they are ours. Whenever the client comes and tells, if some of my clients are watching, they know. When they say we have found a product that suits, I said the search must have taken so many months or years stick to it if it suits you. Even though
Yes.
product, I'm not going to change it because for all you know, it may not suit you. So just stick to it. But there is this sunscreen of ours. I've not come to commercialize anything, but it has really worked for people for 25 to now. We finished 26 years in May on the
Congrats
20.
on that.
That is one this thing where we didn't have to change the formulation. But coming back to what people should look at, some people don't like that very glazed look of zinc
Yeah.
titanium. But if we give them generic names, I think people will get confused. And I think
No,
surprising.
take the brand. Take some brands. Like name 3 brands. One is your Skin Lab. Name 2 more brands.
So we have Antelios,
Mm, I like Antelios, La Roche-Posay. Yeah.
La Roche-Posay. They have that very nice one. They have a tinted one also with SPF 50.
Mm.
I love it because then it does both the jobs. And another sunscreen. You tell me the third one.
I'm gonna say my brand now. So I've been formulating since my London days, but I have 4 different sunscreens in my armatorium because I have for oily skin like a gel kind of base, and then for the drier skin something a little bit more creamy with moisturizers and ceramides built in, and I have a tinted one like a BB cream which has a SPF 26, which is what I use. Like right now I have my BB cream on because I don't like makeup. Like I know you too. You also like your skin all fresh because you have fabulous skin, and I like my skin fresh too. So I just put a BB cream. I'm sorted. These are the ones, but I like Antelios, I like Heliocare, and I like Neutrogena. I actually like Neutrogena sunscreen for like everyday use for my body and stuff. And if patients can't find our sunscreens, I say, okay, just try and pick up Neutrogena.
Yes, that's good. But
Yeah.
sunscreen, forgot to mention one thing to people following us is that it has to be reapplied regardless of where you are
Yes.
at home, because however good a sunscreen may be, whether it's Chaitra's, mine, or La Roche-Posay, it loses its efficacy after about 4 to 5 hours. So I always tell my clients once after your shower, because it's right there, and once after your lunch, which is after 4 to 5 hours, just at least these 2 times apply it. And those who don't have a very oily skin, you can reapply on the morning coat, and just patch up your makeup.
That's a good suggestion. So there's a question here. How do you take care of your skin when you have PCOS?
Yeah, I read that.
So for
So
people who don't know what PCOS is, it's polycystic ovaries. It's a condition where there's a hormonal imbalance and it has to do with your ovaries. And you can have excess androgenetic hormones, and you could have like acne, hair thinning on the scalp, hair fall, or excess hair growth on like your facial areas, and also easy weight gain. So Jamuna, what would you do for a PCOS patient?
So I always tell my doctors, assistant doctors, that so many of the symptoms and signs that we see in the clinic when they walk in through
Mm,
the are mainly in women, are mainly because of the polycystic ovaries.
yes.
Very common. So those who have need not worry about it, need not even worry about their pregnancies. A lot of them do. But coming to what are the issues, like you mentioned, most of them we won't repeat, but one of them is dullness of the skin. So regardless of what they do, what kind of a lifestyle they have, normally when they're doing their exercises well, eating right, sleeping enough, drinking 3 liters of water, following everything, they usually have a nice glowing skin you're supposed to be having. But come PCO, and you will see that they will have a dullness of the skin regardless of what they're doing. So this dullness of the skin, I feel, first of all, treat the cause. Go to your endocrinologist, or we can treat it. I can treat it to some extent, and
Mm,
go and see if there are more than 2 hormones that, along with polycystic ovaries, sometimes you have other 1 or 2 hormones that could be imbalanced. An endocrinologist, that is the doctor who deals with glandular diseases, he or she will sort it out for you. Once you start treating the cause, it becomes that much easier to follow all that we are saying and produce results. But such people may also have to visit clinics for a soft gel peels, for a
mm.
microdermabrasion, for more counseling on how they should treat their skins well. The nutritional supplements become very important here. And I think certain peels from from the absolute mild to the medium depth ones,
Yes.
um, lettuces that we have in the clinic, where there'll be a little downtime, but they'll see good results and a great home care that we can give them to follow with some repair creams that even for young girls. PCO is usually you see in youngsters, so even for them we can give them some night care to take care of. So that is where the skin is concerned. If there is hard hair and all that, everybody knows there's laser hair reduction, and the laser hair reduction works well when the cause is controlled. There's no point. So it is best to see a doctor to get the test done, find out what your cause is, get it treated, and then come to do all these cosmetic things. I think that will work very well.
I think what you said is so true that, there are specialities for each thing. If you have a skin and hair problem, you come to the aesthetic physician if it's a cosmetic problem. But if there's an endocrine problem, please go to an endocrinologist, because a lot of times people try and do everything, and that's when things get messed up. And you have to see the specialist. And polycystic ovaries, like Dr. Jamuna said, it is a multi-speciality concern, so it has to be managed with a skin doctor and then also a endocrinologist, right, Jamuna?
Yes, skin doctor, endocrinologist, gynecologist, dermatologist.
Gynecologist.
So this is the area of specialty of these. I mean, these are the specialists who can look into this problem and guide you. And I feel today, because there is more, what would you say, more pressure, more competitiveness. There are more, previously people would ask, in your time, didn't you have polycystic ovaries? So
Yes.
a lot of us had some symptoms, but during the first pregnancy, like as you know, Chaitra, it just reverses,
Mm,
and all the pimples go away, the hair comes back, etc. All the hair gets thicker, and
mm,
it goes to normal. But our times, maybe the stress levels weren't as much. It's all relative. But today, girls show more symptoms. They show harsher or more aggressive symptoms. The hair is all really very hard, the ingrowths after waxing, the darkening of body folds, the hair
yeah.
loss, the frizzy hair, and it's endless. So some may present with only some symptoms depending on how it is in the family. I've noticed this over my 26 years of practice, that I mean, some may just come with a hair fall and they've gone to so many other specialities. I mean, hair doctors, till they
Mm,
come, and I think maybe that it could be a polycystic ovaries. And lo and behold, most of the times it is. And then it
yeah.
gets treated with a simple treatment for PCO. So
Correct.
I think, yeah, it is very important to treat the cause.
Yeah, and
And
have
the
you noticed that there's an increased incidence of hypothyroidism and thyroiditis and insulin resistance in our patients nowadays?
sorry, I didn't get the question.
Oh, I said, have you noticed that there's an increased incidence of hypothyroidism and then thyroiditis and insulin resistance in our patients nowadays?
Yes, so we have a lot of patients with insulin resistance, and they're usually associated with all these hormonal, imbalances. And then just getting some tests done, seeing the specialists. One of us can deal with this also,
Yes.
and then on the medication, it breaks the resistance, insulin resistance. It helps them to lose their weight. Also, it helps them to get their hormones more regularized, and I think easier, and
Mm,
treats them. So I think it is very important to get these tests done. Um, Actually, whatever is mentioned by a doctor when they go,
yeah,
to take this
you're right.
light, because there are answers to every problem that there is. I always say, when there are answers, why not seek?
Yeah, very true. Very true. And one of the common things I get asked is, my grandmom has such great skin. They don't have any issues. Why do I have all these issues? And I tell them it's the stress of these times. It's the stress and it's the pollution, because pollution is not just pollution in the air, but it's also pollution in all that we eat. Like, earth water, the groundwater has one credit card worth of plastic or plasticine in it when we're having it. So that's what I tell my patients typically.
Yes, I agree.
So, yeah, one of the questions,
And
repeated questions here is, what do you do for pigmentation?
so for
Hyperpigment.
pigmentation, answered about the sunscreen, the nutritional supplements, the blocks that we, kind of physical this thing, like I said, the cotton dupatta, the big,
Mm-hmm,
sunglasses,
mm-hmm.
and be away from the sun if you're in a vehicle as much as possible, not on the side of the sun, and try not go out between 10 and 4. And of course, clean your skin. But then you can have, and the nutritional supplements, of course, you'll take most of them after breakfast, and at night there would be a home care regime that will contain, y'all can make a list, because these are harmless things, because something that is strong we won't
Yeah,
recommend openly like this, because it does not apply for all skins. But otherwise, at home, whilst we're sitting at home, you can try things that contain vitamin C, kojic acid, arbutin. They are all berry extracts, and licorice
yeah,
is from rice, right? It's from rice,
yeah.
licorice. So,
And
but they
Emlica is from gooseberry.
yeah, berries, and they're from absolutely natural ingredients. So extracts from them will work very, very well. So just, I think you can use these. I always say less is more. That is my
Yes,
mantra. That take tiny dots of it, like a small pea or a chana dal, or sometimes when you're using, stronger products, you can use pinhead sizes. Spread it over 6 fingers, just so that we know that we are not putting more at any point. You can start with the pigmented area, apply it like this, and then of course you've used most of it, then the remaining you can just apply. If you need another little bit for your neck and the back of your hands, you can do that, and then coat that with, I mean, on top of that, use either a moisturizer or a gel for an acne skin. Like Chytra said, she has all these different kinds. And because a thick cream will cause acne for you. And for dry, normal to dry skin, the repair agent can cause dryness of the skin. So apply a nice thick coat of a thick, medium thick to a really thick night cream. So I always tell my clients, because they say, which night cream is good? What do I?
mm,
So I say, since you're using the repair agents first, you need not really look for the ingredients. All you want is to hydrate your skin, so that when you wake in the morning, it's not, it's not parched. It's not, you
yes,
don't feel. That is another test that the product is working for you. Whether it's a face wash, whether it is a moisturizer, whether it's a night cream, whether it's your repair cream. If it is doing too much in the morning when you wake up, if it is, you feel the dryness when you're talking, you feel the stretching of the skin, it feels a parched feeling, that means the product is not right for you, or you have not hydrated enough.
right. That is true. You're right about all of these things. I think that's great advice. Now, there's a question. Do you
I know
use
you might
niacinamide?
think I'm wrong.
No, no. Do you use niacinamide?
Yes. Niacinamide, we have tried, and we are also working on formulations. And niacinamide, we have using in most of our products, because it is an anti-inflammatory. It has, that's why, great healing properties, and
Yeah.
along with other ingredients that we use for repair. It is a very, very important, and it's available in our country as a raw material. It's available in the chemist. So I think formulations that contain niacinamide are really good. What do you feel about it?
I agree. I think niacinamide is one of the new world discoveries that's really good. It's a natural product. It actually belongs to the vitamin B family, like a B3,
Yeah.
and it's anti-inflammatory. It also restores your skin barrier because it protects the moisture barrier in your skin. So it has many folds. So I use it a lot for acne patients and for patients with pigmentation because you need something that keeps that skin calm. So I use it more as a calming agent.
Yes,
One
it calms.
A really good question. Sorry,
We
go
use
ahead.
it, soothing agents that we use for the skin, because we abrade the skin quite a bit when we are using our lasers, when we are using our micro needling, when we are different kinds of treatments. So
Mhm.
niacinamide is very good as a soothing agent also.
So there's a question. When do you like your patients to apply vitamin C, Jamuna? Do you ask them to use it in the daytime or do you ask them to use it at night?
People do use during the day as well as the night. It is a water soluble vitamin, so and we use it whenever you're using it in a product. It's a stabilized vitamin C, so it is very safe. So that can be used in the day as well as the night. I prefer products mostly in the night. I tell my clients how to layer it only because when you're sleeping, you're undisturbed. There's no pollution. There's nothing. There's no brain circuit telling anything. It's all working on the outside, so you're peacefully there and the active ingredients are doing their job. If niacinamide is applied, it's doing its anti-inflammatory and repair job. If retin is applied, it does its dispersion of pigmentation. It does its rebuilding of collagen and elastin. It works on various exfoliation. So we are using different products for different, now since we're talking about pigmentation, melasma, Indian skin, these kind of repair agents and the brightening agents as a combination. Brightening is all that we said: vitamin C, uh, you know, um,
Yeah,
kojic acid, arbutin,
glutathione,
etc.
kojic
You
acid.
start yeah, then you go and see niacinamide. Then you go and see a doctor who will give
Mm-hmm.
you the next grade, higher grade of products which may contain peptides and retin and all those, that next level, azelaic acid, etc. So then that grade, so that is the application format. And then when they come to us, we are going to guide them on what are the treatment protocols that are there for melasma, the soft gel peels, the
Yeah.
microdermabrasion, but they can't take away the protective layer of the skin as in microdermabrasion or a soft gel peel. Though we apply sunscreen in our clinics post the treatment, you really have to protect yourself from the sun for the next few, maybe 7 to 10 days, more than other times, because your skin will be vulnerable to more pigmentation. I think you've often noticed, or people, clients of ours who have gone to another doctor whose prescription says perfectly the whatever the prescription has to be for pigmentation, it's all there. But the client says that when I applied this initially, I got the results for 2 or 3 days.
Yes.
And then after that, it has only gone darker or they've gone bigger, my patches. So one thing I always tell my clients is this is absolutely right. The combination cream or whatever else for your pigmentation. The thing that you have to remember, is how much of the quantity that you're using. Because if you're using a larger quantity, it is
Yes.
going to make the skin very sensitive. The patch, it's already dark. The pigmentation is in plenty. You're applying this, okay? When you go out in the sun, your normal sun exposure, this sensitive part is going to absorb more sun rays than this which is not treated. So this, whenever sun falls on the skin, like I said earlier, the melanin from here goes up here as a protective mechanism. So what's happening, Chaitra, actually from here more melanin climbs up here as a protective mechanism
Mm.
because the sensitive skin. So applying very little is very, very important for results. Okay, that is one mistake, yeah, that they do. They apply too much of it. And second is exposure to sunlight has to be kind of protected exposure to the sun. Otherwise it's only going to get darkened, it's going to get worsened. So though the doctor is right, they have just taken the product like this and applied a whole coat and slept overnight. And then so this is very important, that absolute traces of the active ingredient, and then your protection.
I totally agree with you on that. Only thing I do a little different is I do use vitamin C in a serum form, like L-ascorbic acid formulation, at least 15 to 20 in the daytime also, along with ferulic acid if it's available, just as an extra photoprotective barrier. It comes down to, like you said, extra layers and physical barriers. So I'll use that, and then I'll have them put sunscreen on top of that to give them a booster. But if it's a cream form, I always prefer all creams at night. It's best when the skin is breathing and the absorption is uninterrupted.
Yes, absolutely. So the clinic treatments can be the lighter ones where sun protection and is necessary, avoiding the sun as much as possible for the next following week, or you go with a little downtime, 7 to 10 days downtime, to peels like a reticus peel that contains
Mm.
retinol, doing something that contains azelaic acid. We are doing these so those peels, or you go to the next level. We are doing where you're doing the micro needling with a PRP, platelet rich plasma. So since we are having so acellular plasma with platelets and growth
Mm.
factors, it remodels even for people with open scars, the pitted acne scars or the open pores. It works. This treatment works very well. Also on the pigmentation, I've seen that the results are really good after 2 or 3 sessions a month apart.
Yeah.
What would you
We
say?
also do Q switch lasers. Along with this, we also add Q switch lasers. Like first, I'll always start with the peel, the basic ones, like you said, and then build up their skin slowly over the next few months. And I always tell my pigmentation patients it's at least a 6 months to 1 year program. You're not going to get instant results. If you do get instant results, it's all going to come back because it means that on the deeper side, we've not been able to suppress it. So you've got to hold our hand for a year, and it might take 3 to 6 months before you see results that makes you happy. So just stay with the program.
Yes. So
What about dark circles? Dark
yes,
circles, Jamuna. Do you have a
yes.
special cream for dark circles, or can you use the same face cream on the dark circles?
So for the dark circles, we Indians are really prone to dark circles, sunken eyes. That's part
Yeah.
of you and I have. I've mastered my
Glasses?
glasses. Yeah. So then that is we have seen that even in teenage kids up to any other age, I mean, even to 80s and 90s because of the migration of the fat pads in them. But we are genetically kind of, have the dark circles. We are blessed with them. And they're usually genetic most of the times. If you ask for a history, that is it there in the family? But the client, whether it's genetic or not, is just seeking advice of how we can lessen it. They just
Mm.
don't want our expert this thing saying, oh, I diagnosed that it was genetic in your case. So it could be deficiencies, it could be, hemoglobin, lowered hemoglobin, or prescription glasses and you're not wearing it, or screen time because lots of kids work only on the computers. So the eyes get tired. When the eyes get tired, the muscles holding them at the same focal length, etc. And so you do get fatigue of the listing and darkening of no proper blood circulation. That's why all those who are working on the computer, you are advised to look away from the screen from time to time, squeeze your eyes, look at something green, come back, and so that's one of the things. The other thing is during the day you can use your vitamin C and your sunscreen and your big glares, etc. Because there is a little bit of photo aging because you can see the crinkling also in slightly older kids. I mean, I'm talking about 30s,
Mm.
etc. That is young. And then, yeah, at night, you can use your famous tranexamic acid. It works very well because it works on that little pigment that is dropped by the little fine capillaries when they break. You can use a mixture of vitamin K, tranexamic acid, and then, of course, the usual kojic and bearberry, arbutin. Any of these milder ones, you mix and then apply it around the eyes. Again, the size of the dot has to be so tiny, only on two
Mm.
fingers, and it goes like this, pat, 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 all along. If you have them on the upper eyelid, go all around, and you can leave it on because they're mild ingredients. You can leave it on the whole night. Wash it off in the morning. Do it alternate nights in the initial stages, because that's always a good practice to see that your skin is accepting. It's suiting you. It suits your skin type. It's not causing any adverse reaction. So do it alternate days, and then you can always do it every day, and you will definitely see an improvement. And over a period of time, like we were I was just talking up to someone about our Indian faces. If anybody comes for a consultation and they want to know what are the things that we can fix to make them, sometimes they come out with a direct request that something is bothering them, like you said, the under eye is bothering them. So mostly you see a component of two things. One is the under eye dark circles. Second is that it is sunken in the
Correct.
just below the eye area. It's sunken, so they look very tired eyes. So first we start treating the skin, because we do have injections of hyaluronic acid. People who have not heard may feel shocked that near the eye, will the injections work? How do you give? Are there any side effects? Does it, work? You're far away from the eyeball, but we are experts, Chytra, myself, at doing the under eye. We've been doing it for decades, I think, filling up with hyaluronic acid, which is the gel, which is the ground substance of your own skin. So you don't have to worry, and it's really very safe. And we go and fill the hollow. It gives an instant freshness, and you look more youthful. You look fresh more than anything else. And in people who are like in their 50s and 40s, 50s, it really takes them back so many years. And then you're working on both the aspects, and I think it makes a wonderful. And internally, you need to work on with your iron, if at all there's a lowering of your
Deficiency,
hemoglobin,
yeah.
work on taking the supplements, that is vitamin C. You'll be taking iron. You'll be taking what else?
Vitamin B,
L.
complexes.
Yes, our
Right.
favorite iron. So I think all this oil capsules. So I always say, oiling yourself within and without. So, and keeping the skin moisturized, because the drier the skin is, the darker it will look and more crinkled will it look.
So, Jamuna, I'm going to ask you, what do you do when there's that structural problem to the eyes? And also, just in terms of the face, when you look at it from the skin, let's go to beautification of the Indian face. How do you approach an Indian face? We all talk about global standards of beauty. Do you think one template works for everybody, or do you customize to the person in front of you?
Just like you and I do, because we have worked at several conferences together. We do a facial assessment of each face that comes in. First, we ask them what their concern is, of course, because we have to address that. Otherwise, they'll be very unhappy, even if we give them the best of results. So ask them what their concern is. And as you're talking to them, you're going to guide them. Now, what are the Indian faces? We cannot call ourselves Asian, because the Asian faces, they are broader, wider,
Yeah.
and they have more flattening of Asian. When you're saying
Yeah.
looking at Thailand, you're looking at, I'm just so that so you know which faces to visualize. They flatter in the center, so they have a flattened dorsum of the nose, and this medial part of the cheek, which in us gives us the youth, this part is missing. It's flattened. It's not missing. It's flattened. So that is how they are born. So we can't classify Indian faces as Asian. So we are more like, in our bone structure, like Caucasians, but we are wider than Asians. Our faces are wider. And one thing that I've noticed over a period of time is that we have a shorter chin. So we fall short where the mandible or the chin is. So if at all we are looking at proportions, and so we want to make the face a little thinner and make it a little longer. We want to fix the under eye area, because after doing everything, if that is left tired or looking hollow, it won't look good. So that, since most of us have this from at all ages or during all decades, looking at that aspect is very important. Last but not the least, as we age in Indians, there is a bulging. If you see Caucasians, I think there is just a disappearance of the fat pads that go. So
Yeah.
their skin, yeah. So their skin sags, and as it is, the photo aging is there. So they age differently. When Indians age, we are blessed with skin that have a longevity because of the melanin in it. So what it does is, there is a little bit of going south of the fat pads,
Mm.
migration of the pads, they go down and they form
Correct.
this famous jowl.
Mm.
But another thing that happens is there is all bulging of the tissue in the center of our face. Okay. Now, when this happens, if we go for beautification or enhancement of our looks, or we want something to happen, we want to look better, and if someone puts more fillers, that means the hyaluronic acid gel fillers, right here, you're going to be having those, pillow, this thing,
Mm-hmm.
cheeks. So our
Yeah.
whole aim would be, if you can see on my face, because yours is young and stretched, but if you do this, I've been at home for 4 months now. So if you do this, if I'm pulling at the right vectors and I'm working on the side of my face just with the fillers without surgery, this is how even surgeons work. This is the incision
Yeah.
that they take. So that is exactly where we are putting our injection. If you see this side of my face, that is one point. I'm working on the sides. In front of my ear is the second point, and near my jawline would be the third point. And if you see this side, which is not the better side of my face, is looking much better and lifted now. And the bulging, now if I do this side is not going to bulge, at least for some time,
Mm.
at least for
Mm.
8 months to a year. So
Mm.
this is how we work. You can see now how much younger I'm looking, Chaitra,
You look
right?
great already. You don't
No,
need to look any different. You look
nonsense.
amazing.
Thank you. You're my lovely friend. So I'm showing to the audience, this is how we work in Indian faces. And when I go back to the clinic, I've started going, but now I've not had, enough time or the guts to, post COVID, to get my chin done. I have to do it every 6 months, just fill this and
Yeah.
increase the length. And
Same.
immediately it become, and so that is what we work on. I'm also deficient on the chin. So the moment you get this back and this lengthen and a little bit filler here, it looks amazing. I look fresher, nicer, and these little, pits that you have near the nose. So this is how we would treat an Indian skin, always keeping in mind that Indian skins, they're always looking for the glow. They want the radiance on the skin. So the texture improvement is extremely important. Whether we are doing a microderma, whether we are doing a peel, the home care is very important.
I agree with you, and I think it's so important to be honest about what needs to be done because, like we always do that. Like we work out to keep that body fit. Your body is going to gain weight, but we're really working out, we're dieting, we're doing everything possible to get our shape, and we cut our hair, we color it. So when people are losing their skin, I think it's so essential that you look upon it as another maintenance program and not be ashamed of doing something. What's your take on this, Jamuna?
Absolutely. I think you should feel proud that you belong to that era where you are, you can afford these things,
Yes.
about these, that they are safe, because everything is there for you to read, to ask your questions, to come and, take counsel with us, take a consultation, be sure, and then come for your treatment. And there is no harm because everybody is doing it. That's what I feel really bad, Chaitra, is whenever I see posts of all other celebrity trainers, celebrity dietitians, and they show off their celebrity list, and we,
Yeah.
both of us, absolutely, all of us have to keep quiet because nobody is going to endorse us. Nobody does.
In
So
fact,
I think
patients run away from me in parties. Like I've had that where I never talk to patients openly unless they come and say hi to me because they don't want to be associated.
absolutely, absolutely, a lot of them are, but but I think times are changing and people are feeling that. But yes, still
Yeah.
there's a taboo of topics in
Yeah.
India.
And I think, just own it. I mean, just own it, because why not? I mean, you're doing your hair, you're doing your nails. You're never going to run around with chipped, broken nails. So if your skin is having pores, if it's having pigmentation, if it's having acne or dehydration, it's crying for help. And skin is the largest organ in our body.
Yes, of course. And then, of course, you can say that I'm going for my PRP sessions, or I'm, they just say I've started doing yoga. So many of my clients, I've read it in.
Mm.
I've started doing my yoga more seriously, or, I've started my own gym, and that's why I've got
Yeah,
this glow. So
yeah.
it's a, yeah.
So, Jamuna, two constant questions that they've been asking. One is retinol. Do you have a brand that you recommend for people to use? And how do you recommend them to use retinol? And can you name a moisturizer which you think is good? Two questions.
So what is the first one? The retinol.
Yeah, retinol. What brand of retinol do you use or suggest? And
I
how do you
say,
advise your patients to use retinol?
as we sit and openly advise about these, molecules that are a little stronger, friends, just remember that this is a strong thing, but I love this molecule. It does a whole lot, even for youngsters. It, kind of prevents, it's in the preventative stage, it comes as a great
Yeah,
molecule. As you get on in life, it kind of starts reversing. And at the stage that I am or later, it really works very well. So this the mildest one is 0.025. So right, Chaitra, 0.025.
yeah,
So
yeah.
yeah,
You're right. Retin-A. Yeah.
you get it as UGuard in a pretty tube.
Mm,
You get it as UGuard. In fact, I've started recommending it for my grandson who's 12 years old and he's breaking out into pimples.
mm,
So once or
mm.
twice a week, I use that. So it does work. Bring down the inflammation, reduce the scar, exfoliate the scar. So it does a whole lot of things. As you grow in age, it helps in dispersing the pigment. It helps in remodeling the, we lose the collagen and elastin, and that's why the thickness of our skin becomes less. So many of our machines work on that. The lasers that we use, they work on thickening the skin to reverse the signs of aging. This molecule works from outside, but you have to remember that you have to really, when it's retinol that is prescribed, my prescription always has this pinhead size 2 dots.
Mm.
And we say it. So they say when we spread it like this, the dots disappear, but that's exactly as much as you need if you need to use it every day and see good results. Even the indented lines, the permanent lines on skin that some people have
Yeah,
due to
like here.
aging,
Yeah.
they also they also reduce. They also reduce. So
And it's
I
great
think
for
that,
pores too. And it's great for
and
pores and preventing pores.
absolutely, and it reduces the oiliness of the skin, but also uh, you have to remember that it could scale and peel and become pink if you use a little more. Always use some form of a gel or a light moisturizer on top of
Mm,
this. What was
agree.
this?
Moisturizer, your favorite moisturizer.
Again, I can't say mine.
You can. Why not? But Jamuna, you've got to own it. If you have a great product, say so. And why not? I mean, it's 26 years of experience. Come on. If you can't own it, who can? Come on.
How sweet. Yes, but besides that, all I always feel where these moisturizers are concerned, um, going from the very light ones to a medium heavy. When I say heavy, it's how creamy it is, how watery it is, water based, a little cream based, and then very heavy ones for a skin like mine, dry and dehydrated. I need one that is really heavy, and it kind of soaks my skin, and so in the morning I don't feel that parched feeling. So my moisturizers, Clinique, the
Mm,
Clinique brand,
yeah.
uh, from the time I started and we didn't have any products and all, from that time to now, clients, Indian clients, somehow take to that and they like
Yes.
whole bag of
Yes.
products. That goes in the imported one. But whether it's Garnier, whether it's Neutrogena, whether it's Lotus, whether it's any of these, that their moisturizers, it is the formulation, somehow one will have a niacinamide and the other one may have something else, but the basic formulation for the moisturizer, it's oil and water content, it
Yes.
depends on that. The most important thing, my dears, is that you have to use it, see how you find it, and then that
Yes.
would be your best moisturizer, and that would be my best advice to you. Instead of giving you 2 or 3 names, you buy one of these that I've told you, wear it, see that it suits you, and then maybe they have a sample. Some companies do have the smaller, jars, so you can get those and then go on to buy bigger ones. That would be the best
Yeah.
take.
Yeah, I agree. And I think it's important. Oops. Can you see me?
No, I can't.
I don't know what happened. Okay, that's fine. But you can hear me, so let me continue. So, what I was trying to say was that with the moisturizers, it really depends. If you have drier skin, then go towards something that's heavier. Whereas if you have a oilier skin, go towards something that's lighter. And there's always peptides, the ceramides, and there's even hyaluronic acid being infused into these. These are the additives. So think about it and go according to the one that suits your skin, like Jamuna and myself said to you. Choose what
Correct.
suits your skin. And there's something called actives range or prescriptive range, like what Jamuna has formulated for Skin Labs, what I formulated at Cosmoderma and SkinQ. These are what we call as actives range. So they actually have creams and ingredients that are actives, which can penetrate your skin barrier and deliver to your skin, as opposed to, let's say, just a over the counter cream, which will just have creams but not necessarily be able to penetrate. Right, Jamuna?
Yes, and that is the difference, that even though the doctors are formulating and maybe, but it is sold over the counter and not made by a doctor necessarily, though they have a big R&Ds. So I think this way, since we are selling it through, at least ours are being sold at the clinics, so it comes straight from a
Yes,
doctor like a prescription cream.
correct. Exactly. And there's a question saying, do you ever recommend glycerine and rose water?
Do I mix retin with rose
Rec-
water?
glycerine and rose water.
Yes, you may. You may. Glycerine has, it's a humectant, so it has the property of, if you apply glycerine on a dry skin, like my skin will do well with glycerine. Even your young skin will do well with glycerine, because its job is to take moisture from the surrounding and put it in the area that you have used glycerine on. So if you're mixing rose water in it, nothing to worry. It might dilute the glycerine a little bit, but it's fine. No
Yeah.
harm.
Yeah, and I always tell my patients they can use retinol and vitamin C together. There is no issue, but I only advise patients with acne to be a bit cautious with vitamin C because it can irritate acne prone skin. Have you seen that?
Yes, because it is an
Yeah.
acid after all, ascorbic acid. So
And our final question, Jamuna, because in 2 minutes Instagram will cut us off. Because I don't know if you know, but we've been on for an hour. It just feels so
yes.
fast. Okay, the
Okay.
last question is alt therapy versus injections.
Okay. Both have a different role, to play. Art therapy is the skin tightening device which uses ultrasound. So it tightens all the layers from the skin up to the bone, and so that tightening is, I first tell my clients that first do your eye therapy or your
Yeah,
radio frequency, whichever you want, a thermage or whatever else.
yeah,
Tighten the canvas, and then once it is tightened, wait for about a couple of weeks. Then come to us. Everything is settled. Everything has begun to work, though it takes about 2 months, 1.5 to 2 months to show full results. But we know it is settling down. Then we can use maybe lesser of the hyaluronic acid gel, where we needed 4 ml. Maybe with 2 ml, we can just see which are the points that need to be enhanced or pulled still further, because maybe an eye therapy may not do the complete job. So, but those who say, I don't want eye therapy for whatever reason, then with the fillers, definitely, Chaitra, am I right? With the fillers, we can
yeah,
do whatever we wish
yes,
as as they can go. But we are not doing anything to the texture of the skin and to the skin itself with the filler. We may hydrate it a little bit, but we are going deep down most of the time. So we are not doing something for the skin from outside. So that is where our therapy will come in as an adjunct or as a complement to this.
So thank you, Jamuna. We're going to get cut off in a few minutes, but seconds, but thank you so much for joining me today. Our viewers have so many questions. I think we'll do another episode maybe next month if you have time, because COVID's going to keep you at home for a while. And thanks for joining us tonight. Bye.
Yes, thank you. And I had one or two tips.
So Jamuna had to leave us because we're getting cut off. Thank you all for joining us today, and we'll see you soon.